I think it's only been something that has, I guess, dawned on me more gradually over the years, to come to realize how many people in the background have loneliness as a factor in their health. I've come to realize that loneliness affects people in a great many ways. It has a direct impact on their health. I think research has proven that. People that are lonely often use other means of coping, for example, smoking or eating sweet foods. Often people become quite isolated in the house. They often become more anxious, afraid to go out, and that has an impact because they get little physical activity, fresh air, vitamin D and so on. When people do then develop a health problem, loneliness means they've got less resources for coping with that. So perhaps people to turn to if someone has, for example, an anxiety problem. If you have no one to talk it through with, to vent your feelings, to reassure you, then your anxiety problem can become more serious. So as well as being a cause of health problems, being lonely, not having social contacts also makes it more difficult to recover and to be resilient and cope with health problems. And I think one of the biggest problems we have to overcome is actually, first of all, being aware of loneliness, and secondly, being willing to ask about it. And then you can get on to trying to think what to do. I think we've become much more aware of how closely poverty is tied into loneliness. We tend to think of loneliness as a problem of old age, but for people that have limited economic resources, it's much more difficult to make contact with people. And there's a whole host of reasons for that. At the very simple level, going out for a coffee with someone, which is a kind of basic interaction, is quite pricey for some people, and they're not able to afford it. Simply transport to get places can be a big part of their budget. And there have been surveys in Glasgow, for example, that have demonstrated that twice as many people in areas of high deprivation identify as being lonely or socially isolated than in areas that are more affluent. In Drumchapel, there's a lot of amazing things going on. For example, there's an arts workshop that's very well established that encourages people to get into artwork. There's a recovery cafe in a local church, which is a fantastic place for people that have addiction problems, and has really helped a lot of people to come out of that. One of the other churches has a befriending coffee morning. So yes, there's lots and lots of fantastic community initiatives around, but as GPs we're often not aware of them, and we often don't know how to point people in that direction. I think housing associations have a really crucial role to play in this, and I think in a better future, I think communication between housing and health would go a long way to supporting people, but also alleviating some of the problems that we face in our both sectors. Housing officers, I'm sure, know most of their residents and will be aware of people that live on their own or who don't have much social contact. So I think being involved in community initiatives like cafes, like befriending programs, helping people to connect with one another and also learn new skills to improve their quality of life. The Links Worker programme has been running for 3 years, and it's involved a community links practitioner joining a GP practice team, and their role is to help people connect to resources that will improve their health when social problems, economic problems, personal problems are the main reason why their health is impaired. Traditionally, we'd have very few resources to respond to that. So if someone comes in with a personal problem, say to do with benefits, they might end up walking out with an antidepressant, which is not exactly solving the problem. So the links practitioner will spend a good bit of time with the patient, much longer than the GP can spend, really try and get down to the bottom of the problems and then try and help them find ways of fixing it. They don't only meet with the individual patient, but they also meet with community groups and others in the community to try and build connections. So they may be an important person in the future that housing associations could connect with if they become a well-established kind of role across Scotland, as the government seems to be saying they will. Being connected to other people can produce a great deal of resilience in terms of simply strength in numbers sometimes, or having other people help someone to be assertive. or indeed advocate for them. They can also be, the connections and networks we have can also be a great source of advice and information. So if someone, for example, thinks they might have a health problem, having someone else to talk it over with can often help them to know what to do. The same is true with bringing up children. Having a parent or grandparent or friend to talk to can help. We learn a lot through our personal connections. People's capacity to recover and rebuild their lives and make connections is fantastic, and I think we just need to create the opportunities for that to happen.